Good afternoon, everyone. We want to call our meeting to order. We apologize. We're running a little late. We ran over in the session and just got through. We're giving everybody a couple of minutes to sort of, take a break between there and in here, and some will be coming in. If any of you folks that are standing in the back, if you'd like to come and have a seat, you're welcome to do that. Be glad to have you just move up toward the back and find you a seat. Might be a little bit more comfortable. We've got the sign-up list that's here. We've got a good number that have signed, but if you haven't signed and you want to be heard, we need you to sign this list. And what we're going to try to do is let you come up and talk to us, those that will be presenting. And if you have any written material that you want to give us, if you'll just come by and leave it with Tara over here on your way up, we'll do that. And just in the interest of trying to let everybody that wants to be heard, we'd ask you to no more than 5 minutes, and you certainly don't have to take 5 minutes if you want to. And brevity is appreciated, and you may be graded on how quickly you make your point. But seriously, we think it's important that if you have something you want to share with the committee, we certainly want to hear from you. And what I'll do is we'll call who's going to be up, and then when I do that, I'll tell you who's on deck for the next, so maybe that person can be kind of moving up to the front, so we'll move along pretty quickly with that. So without further ado, we'll go ahead and start, and first on our list is Representative Bob Trammell to come and speak with us at the podium over there, and then Mabel Thomas would be next.
Thank you, Mr. Chairman and members of the committee, and I'll be succinct. We have submitted a request in writing for a $200 million appropriation for fiscal year 2019 to expand Medicaid in Georgia. Succinctly said, this appropriation would cover approximately 600,000 Georgians with the expansion of Medicaid, according to the fiscal note, which would cut in half Georgia's uninsured rate. It would also provide a needed injection of cash to struggling rural hospitals, 6 of which have closed since 2013. And when you analyze the fiscal note and the number of Georgians who could be covered by Medicaid expansion, basically it allows us to avail ourselves of approximately $3 billion a year in federal funding by providing a match, which will at this point be 6 cents for 94 cents to federal, which will ramp down to 10 cents on the state contribution to 90 cents on the federal. Mr. Chairman, I'm happy to answer any questions. I appreciate the committee's consideration of our written request.
Very good. Any questions for our presenter? Thank you.
Thank you for your time.
Did you have a question? No, we have another representative. Oh, okay. Come on up, Ms. Are you ready now, Karen? Okay. Representative Bennett, you want to come up? We'll recognize you now. And while we're doing that, we've got some special guests in the room that I need to recognize. Some of the group here with Hometown Health, and just happen to have a group from Emmanuel Medical Center in Swainsboro and Candler Hospital, Candler County Hospital down in Metter. That happens to be in District 158. They're just some really fine folks. Y'all stand up and let us welcome you to your capital. Thank you for coming.
Thank you, Mr. Chairman.
Yes, ma'am.
I have 2 other members of organizations with me to speak to this as well. May I invite them up? May I invite the other 2 up who have come to speak with me, Ms. Amy LaCicero and Ms. Ball, Kelly Ball. Amy from the Physical Therapy Association of Georgia, Ms. Ball from the Speech and Language Hearing Association. Mr. Chairman, and to members of this great committee, I have come today asking for an increase in the Department of Health budget in the amount of $1,103. This money that I'm asking for is to allow for parity for physical therapy, occupational therapy, and speech therapy services for children ages 0 to 3 for the Babies Can't Wait program. Last year, we increased the reimbursement rates for the same services under the Children's Intervention Services program in the Department of Community Health. And today we come to asked for parity for the same group of children. However, under the Babies Can't Wait program, we found that that program was in the Department of Public Health. Same services, just in a different department. And so what we want to do is to make sure that our kids are cared for across the spectrum between Department of Community Health as well as Public Health. And I have with me, if you may, Kelly Ball and Amy LaCicero to speak to the need.
Chairman and members of the committee, thank you so much for allowing us to speak today. I'm Kelly Ball with the Georgia Speech Hearing Association, and we work together with the Physical Therapy Association and the Occupational Therapy Association in what's called the Georgia Therapy Tri-Alliance. So I'm here today representing this group. As Representative Bennett said, we're asking for a Medicaid, alignment of the Medicaid rates under the DPH program. Therapists are serving the children birth through 3 with autism, Down syndrome, a variety of developmental disabilities, but are getting paid below the Medicaid rate. This is resulting in the program having difficulty finding providers to serve these kids, and I think there's 3 main reasons this is happening. First, the rates are lower. Second, the administrative work is higher, the workload is higher. And third, the children are required to be seen in their homes, so these therapists have to take the time and cost to drive to the home, yet they're receiving a lower rate than the Medicaid rates. So overall, therapists are incurring more costs when providing services to children in the Babies Can't Wait Early Intervention Program, yet are being paid at a lower rate. We feel that aligning these rates will help the program get more providers and serve these children with these needs in the program. So, and the Department of Public Health is on board with our request. We have been working with this, and they are supportive of it. They just don't have the funds to implement it in their system. Thank you.
Good afternoon, Chairman and distinguished members of this committee. My name is Amy LaCicero. I am a physical therapist, and I've been a Babies Can't Wait provider for the past 23 years. I have 2 things that I wanted to add on to Kelly's, what Kelly just said. For those who are not familiar with the state's early intervention program, the program's policies and service delivery model is dictated by IDEA's Part C. Part C, as Kelly mentioned, requires that our state provide early intervention services to children 0 to 3 in their natural environment. So we see patients in the homes, daycares, Head Start programs, wherever they are the majority of their day. This requirement is grounded in research. It's shown that research has shown that children learn best when learning takes place in context. Serving children in their natural environments where they live and play each day allows the provider to take advantage of everyday learning opportunities and support the family in their daily routines, capitalizing on multiple opportunities of contextual learning. I have no doubt that the best place to see our state's most vulnerable population is in the natural environment. Research aside, this just makes sense. Keeping your fragile babies safe in their homes, being able to see firsthand the challenges the family may have in their daily routines, and being able to help families set up a play environment that is conducive to learning for their children is why, after 23 years, I can't imagine seeing children anywhere else. Second, I'd really like that the state take a good look at how underfunded the EI program is in this state. Georgia has a wonderful framework in place with the Babies Can't Wait program, but struggles to make it accessible to those in need. Babies Can't Wait has done an amazing job of implementing a delivery model that supports families, provides peer-to-peer reviews of services to help decrease overutilization of services, and is working hard to help identify as early as 18 months patients with autism and change the course of so many young people's lives. However, the program is underfunded year after year and struggles to build and retain the network of providers that can manage the patient demand. Please help us restore balance to this system and ensure a future Babies Can't Wait program for the children in this great state by allocating the needed funds to align the therapy providers' rates with the current Medicaid rates. Mr. Chairman, I thank you for your time, and am happy to answer any questions you have about the program and the challenges that the providers have. I also have a copy of an example. I handed this out a couple of years ago when we did the CIS rate alignment. It's an example of the disparity in the rate for evaluations alone. It's just one example. It shows the different steps that we have to take to go from evaluation to treatment and the loss in revenue that occurs for each of those evaluations. So for a company like mine that actually does most of the evaluations for the Babies Can't Wait program in Gwinnett, we lose about $59 for every evaluation we do that Babies Can't Wait pays for, which last year we did over 150 evaluations for the program. So I appreciate you taking a look at it, and we'll be happy to answer any questions that you have.
Okay, we do have a question. Did you all sign up on this sheet?
Yes, we're like 10 down.
Kelly Ball and Amy Lassista.
Kelly and Amy? Okay. Representative Petrie has a question for you.
Yes. Thank you all for being here and presenting this today. I have a question for you. Do you have concrete data to show where there are areas in the state that do not have providers of this service? So are there children in the state who are not being served that could be served?
I believe Katie, did you bring that today? We've been working with DPH, and Katie Cope, or Cop, has, may have some of that for you. I know they have some data on.
I think it's helpful to know.
But we can get that for you.
If you have gaps in service, that really is, that either you either do or you don't. So what areas may have no services, if that's the case, or may have very little?
So one thing that happens in Babies Can't Wait is that a lot of times there is an issue of having enough therapists, but they do have special instructors, which are special education teachers. So many times the children do get the special education services, so they're not going completely without services, but they are not getting the specialized therapy services that they need, or they may have to be on a wait list for it. So sometimes that data is a little hard to find because the kids are getting some type of service, but maybe just not the best or recommended service.
They're not getting it.
Thank you.
They're not, Mr. Representative, they're not getting it. In answer to your question, the physical therapy, occupational therapy, and speech therapy services across the state, and we'll get you that those gaps. Thank you.
Thank you.
Thank you.
Next on our list, Ned Morgan's, Georgia Adult Day Association, and followed by Claire Russell. If you would just identify yourself and which organization you're with when you begin, and then that everybody will understand.
I will.
Thank you.
Thank you, Mr. Chairman and members of the committee. I'm here with Leading Age Georgia. I'm Claire Russell, and I'm here to talk to you about adult day health programs in Georgia. I want to talk to you about something that I'm very passionate about. I want to talk to you personally and poignantly. Where you want to live as you continue to grow and age and learn is pretty much probably your house. And so what we provide as adult day health providers, people, vulnerable people, and most of our clients are between 64 and 87. And that's kind of where a lot of us are nearing that scarily. But you can come to our day centers, and after you're cared for, you can go back to your home and live and be viable members of the community, which is a great package. Now let me tell you what happens in those day centers. We feed the hungry. We have clients that come that don't eat from the time they leave us to the time they come back to us. We feed them breakfast, lunch, snacks, and some we send food home with them to make sure that they have nourishment. We provide accountability to families to make sure that people who are living with caregivers are well cared for you know, in some ways that can limit abuse and provide more care for them, because somebody's kind of taking a look after that. In addition to that, we provide constant medical oversight. Our services have licensed nurses. We are on the site at all times, and LPN and RNs and certified nursing assistants. So in doing that, as we feed people, entertain them, provide socialization, we are giving medication, assisting with eating, bathing, transferring. So everything that we receive, every amount of money that we receive for each client, it's all happening in there. We send them home and they are good to go to the next day when they get back to us. Now, prior to this last year, it had been 17 years since this service received an increase. And I don't know about you guys, but for me, my cost of living has well increased in the last 17 years, much over 5%. So we come to you today to talk to you about getting us off the financial edge. As you can well imagine, employing nurses and staff, especially in the rural areas. I have day centers in Lincoln County, Jefferson, McDuffie, and Jenkins. These are small sites. They are not warehouse sites. They are small that perhaps have 12 to 20, 12, 15, 20 clients in them a day. And without proper or without adequate reimbursement, these sites in these rural areas that are underserved are at financial risk for closure. To date, several have closed in the last couple of years, and without us keeping up with this cost of living and receiving increase that we need, there will certainly be more. Thank you so much.
Mr. Chairman and committee members, my name is Ned Morgans. I'm also with the Georgia Adult Day Service Association in Leading Age, Georgia. And Claire and I tried to team up and hopefully keep our overall talk a little bit shorter. Really, we are trying to follow up on a study committee from the Adult Day Study Committee that was finished up a couple years ago. And in that recommendation, there was a series of 5% pay raise, not pay raises, but increase in rate reimbursements hopefully over a period of 4 years. And a lot of the reasons for that, Claire brought some attention to that, is certainly the increase in costs since 1998 to the present time, as well as the increased costs of providing the service. And so it's not just a rural issue. I know that in Atlanta itself, finding qualified staff members is more and more expensive every day. And so, for instance, certified nursing assistants are extraordinarily hard to find. Nurses, LPNs are very hard to find. So where I was able to pay somebody $8, $9 just even a few years ago, it's now $11, $12 an hour on a certified nursing assistant level. Plus, there's a lot more competition with doctors' offices and hospitals for that same qualification. And the same thing goes with LPNs and RNs and everybody else that we are trying to hire and provide these services for. I would also emphasize that our little part of the care continuum continues to be under financial stress. And so there are a lot of folks that are kind of on the edge. There have been centers that have closed. And it provides a great service, which in the overall cost of things, if you look at it, we provide more service for people living in their own homes at the most cost-effective rate for the Medicaid program. The other point to point out is that the regulatory compliance issues are increasing steadily. There are increasing requirements from the federal government in terms of the Home and Community-Based Services rule and state transition plan for that program. In addition, there have been several software transition programs in CCSP, which are causing a lot of compliance issues for providers. And it's also just even the last raise in reimbursement rates. The adult day service is still waiting for the final 6-month mass adjustment to be paid from that rate increase a couple years ago. So there are a lot of processes that are going through there. We think we're probably one of the better bargains that you're probably going to hear about today in terms of helping folks. We think that we're getting some final numbers from the Department of Community Health, but we think that the overall budget increase would be approximately $1.2 million. For the state portion of that, since that's a matched program with the feds, we think that's approximately a $400,000 ask for the increase. And so providing a significantly more financial stability for these programs to serve older adults and adults with disabilities, we think we're great. We can do some really great work with some extra reimbursements on that. And are there any questions that we can answer?
Thank you. Don't have any questions for you.
All right.
Well, we do have a question.
Thank you. And Claire, good to see you, and an old friend I haven't seen in some time. Good to see you. The adult day health service, so nursing, obviously harder to find all the time, well aware of that, and of course more and more competitive for wages. How much nursing do you have to do in ADHs today? There's a nurse present at all times? Tell me about that.
There is a nurse on site every minute that a client is on site. In addition to the nurse that's on site, there's one that visits 1 to 2 times a month, the secondary nurse, to come and do supervisory visits. But we have to staff a nurse at all times.
Gotcha. Thank you.
So that the RN supervisory visit at our centers, it's usually about at least 4 to 10 hours a week to do all that work. So it's pretty substantial.
So ultimately, with the 5% going forward, would be very helpful to help us keep these open and take care of these folks.
Thank you very much.
Next, I have Charles Harper, and followed by Victor. And I'm sorry, Victor, I'm having trouble with the last name. Midside would be next.
Mr. Chairman, committee members, I'm Charles Harper. I am the Vice President of the Georgia Association of Community Care Providers and also chair our Legislative Committee. I think I know most of you personally. I've been with you guys for 10 or 15 years now, most of the time begging for money. This is the first year I think I've been up here in a lot of years that I'm not up here begging. All I'm asking you to do is support the governor's budget, the Community Care Service Program, Medicaid's manner of paying for folks in personal care homes. Every individual in the state of Georgia that qualifies to be in a personal care home under the Community Care Program, the CCSB program, has to be nursing home eligible. So you guys have the option. You either pay $173 a day for folks on average to be in a nursing home, or currently you're paying $37.03 a day to be in a personal care home. Same thing. It's giving baths, it's taking care of folks, it's providing all the basic needs, room, food, shelter, and safety. $37 a day doesn't go very far. I happen to have a personal care home. My wife runs it for us. It's a good thing we have some other businesses that makes it where we can afford a personal care home, because you can't even stay for $37 in a Roach Motel. The governor was good enough this year to put a rate increase of $12.62 a day, which will be a $3.3 million increase from in his budget. It will remove our rates up to $50 a day. That's not much, it's not enough, but it's a help. All of my association members are home and community-based services. You folks have been very good to us in the last few years. We've been able to get our rates up competitive. We're still behind other states, but we're gaining ground. But the cost of business, I don't have to tell you, the cost of business is going up more, and staff retention is a terrible process we have to go through. So all the Georgia Association of Community Care Providers is asking you guys this year is please support the governor's budget for ALS, Alternative Living Supports, in his budget. Thank you.
Hello, my name is Victor Weissman. I'm a physician and a CEO of MedSite Healthcare. Thank you very much for letting me present here. We are providing adult day health services, personal support services, non-emergency transportation, and home health services. Pardon my accent. The primary source of funds for adult day health centers are Medicaid waiver programs, CCSP and SOURCE. Both fall under 1915C waiver for home and community-based services. And as previous speaker has already mentioned, that the rates have not been increased since 1998, and the only other increase was in 2016 by 5%. And according to the House Study Committee on Adult Day Health Centers, they recommended to increase rate by 5% in 2016, 2017, and 2018. The current reimbursement rate does not cover our expenses. Some agencies are closing, some adult daycare centers are closing, some others are on the edge of being closed. And this is a well-known fact that adult day health centers are probably the least expensive way of keeping patients out of the hospital and nursing homes. Here are some facts related to the rising expenses for adult day health. According to the Department of Labor, an average reimbursement for a nursing assistant in 2016 was $26,590 per year. Now, it is $31,015 per year, which is 17% increase over a period of 1.5 years. In addition, DFACS often is not authorizing Medicaid members on time. It used to be 2 to 3 months delay, now it's more than 6 months delay. We are respectfully requesting an at least 5% increase of adult day health rates in fiscal year 2018. Do you have any questions?
Yes, go ahead, Carol.
Thank you. Just a clarification. Did you say it's taken up to 6 months?
Sometimes it takes more than 6 months to authorize.
Is that all we had, Carol?
I just want to make sure I understood.
Yeah. Okay. Good.
Thank you.
Representative Abel Mabel Thomas.
Thank you so much, Mr. Chairman, and also members of the distinguished committee. There's an issue that's very dear to my heart. I do a lot of work around women's health issues. Did a lot of work with the National Black Women's Health Project and Black Women Wellness, and have served on various committees related to infant mortality. But when I came back to the body in 12, somebody told me about an issue with women morbidity, which is women who are dying at childbirth. And what that means is not necessarily they die on the table, but what happens, they have a period, I think, from the time that the child is born up until maybe a year, and women are actually passing away, and we have the largest, the way it's set up, it says that we have more people dying at childbirth in Georgia than other places. There have been different studies that the state has done, and there's been recommendations. And I believe that some of the recommendations, some steps have been taken. But I do think that more attention should be put on that in the budget. So in general, I support the public health budget that's being proposed. But also, I would like to ask this body to look at allocating money for prenatal care, and then after the woman has a child, then they have something called aftercare, which is called doulas, people who come in to help with the parents to make sure that they are healthy as well as the baby is healthy as well. And I know at the presentation that the Commissioner of Public Health mentioned that they were looking at some of the issues around birthing centers, and I think that may be a step, but I think that we really need to dig in a little bit deeper and look at some of the recommendations that came forth and put money in the budget specifically for to deal with this issue of women mobility as well as infant mortality. And so I just want to go on the record. I understand, Representative Hughley, that there was a gentleman in our body that had some legislation with the same interest. I'm not sure. I don't want to call the name, but there is somebody else that's, as I say, across the aisle that's also sort of looking at that. So I'm hoping that with those efforts, and I can connect with him as well, that maybe some money could put in a larger budget so that we can put an emphasis on families, put an emphasis on women's health and women living, and then put an emphasis on children. And so I just want to go on record in support of that. Thank you very much.
Thank you, Representative Thomas. There's been a lot of interest in that. I know they've expressed the interest of this committee on more than one occasion. Thank you. Who is it?
Representative Thomas. That bill is with Representative Dubnik that you were referring to. Dubnik has, yes, ma'am.
Okay. All right. Chassis chairs. And then Melanie McNeil.
Good afternoon, Mr. Chairman and members of the committee. I am Chassis Chairs with PSA Healthcare, Pediatric Services of America. What we do using the GAP program, which is the Georgia Pediatric Program, which is Medicaid funded, we are able to give nurses to medically fragile children in the home from birth to 21 years of age. These kids suffer from complex medical issues that require life-sustaining treatments, such as feeding tubes, ventilators, they have tracheostomies. They require 24/7 care. And it allows the kids to stay at home, which they would otherwise be in an intensive care unit if they were in the hospital. What we are asking for is an increase of $5 per hour, which would be a 15% increase that will allow nursing providers to increase nursing pay. We are having hard time staffing the cases because we need licensed practical nurses or registered nurse. The licensed practical nurses are not allowed to work in the hospitals here in the state of Georgia. They don't have a training program for them. So they're usually in rehab facilities. So when they come to us, we have to do a lot of training to get them geared up to take care of a child with a tracheostomy or on a ventilator. We have, the program started back in 2002, and we have never had an increase. We are at risk of we're financially stressed. The program requires also for oversight from a registered nurse. We do not get reimbursement from that. Other Medicaid programs do. So we ask for this increase. It would be 15%, and the proposed rate would increase for the year is $6 million. I'm happy to answer any questions.
Representative Petrie has a question.
Ma'am, so the $5 per hour, what is the current reimbursement rate then for nursing? That's for an LPN.
$5.
What is the current rate? So you told us you're asking for $5 to increase it. What is the current rate?
The current rates for an LPN is $35 an hour.
$35 an hour for an LPN?
For an LPN.
Thank you.
Yes. Thank you for your time.
Thank you. Melanie McNeil and then David Tatum.
Good afternoon, Mr. Chairman, members of the committee. I'm Melanie McNeil. I'm the State Long-Term Care Ombudsman, and I'm here today to ask about the governor's recommendation in the Department of Community Health budget at section 17, it's the Medicaid age blind and disabled. The governor put in part of a $20 personal needs allowance increase, and I'm asking that you increase it to the full $20. What I brought with me today are over 1,000 letters and signatures on petitions from nursing home residents. They wanted you to know how important it is for them to have a personal needs allowance. Just to give you a little information, people who live in nursing homes, that is their home. So they have to pay for their clothing, they have to pay for their shoes. If your mom or grandmother wanted lipstick, as most of our moms and grandmothers do, that has to come out of their personal needs allowance, which right now is $50. It was raised from $30 to $50 in 2006, so they haven't had an increase in 11 years, 12 years. So I'm asking, the line item is 17.7.4, and so rather than a partial increase for the $20, I'm asking that you put in the full $20 this year. And these are for you.
Thank you. And I'll remind any of our presenters, if you have written information you'd like to leave with us, we'll be happy to accept it if you'll just pass it along to Tara right over there. And let's see, David Tatum and then Nancy Paris after David.
Thank you, Mr. Chairman, members of the committee. I'm David Tatum with Children's Healthcare of Atlanta, which was the entity formed in 1998 by the merger of Eggleston Children's Hospital and Scottish Rite Children's Medical Center. We're now the largest pediatric system by clinical volume in the United States, right here in Atlanta. Back in 2008, we acquired and assumed operations of the Marcus Autism Center, a national center of excellence, one of 5 so designated in the United States. We were delighted last year when the governor recommended and the General Assembly approved autism coverage by Medicaid. Unfortunately, the rates offered by the Department of Community Health for payment of services for autism treatment fell short of covering costs at the Marcus Autism Center, significantly in 3 of our main programs. One is the Pediatric Feeding Disorders Program, which literally teaches a child to eat. These are children which would otherwise be on internal feeding through a G-tube, and our position is the long-term medical cost of those kids would be higher if they have to be hospitalized. It also affects the Severe Behavior Program. These are kids that do damage to themselves. They break their own bones. We've had them pull their eyeballs out. This is something that requires weeks of intensive therapy to try to address. The last program is Language and Learning, where we literally teach a child to talk who has no language skills and an inability to learn them. Again, these are services that are unique to Marcus in many cases. We're the only ones that have the intensity of these services. We've calculated that the shortfall is about $3.5 million between our costs and what we would otherwise have gotten paid by the Department of Behavioral Health contract that's been in place for some time at Marcus. With the federal FMAP taken into account, that's about $1.2 million in state money. And the reason we're asking for it in the 19 budget is the Department of Community Health and the Department of Behavioral Health have been very gracious to extend that existing contract through June 30th to allow a transition period for us going off the contract into the new Medicaid rates. I'll be happy to answer any questions.
Don't have any questions for you. Thank you. Nancy Paris and then Jenny Helms.
Thank you, sir. I'm Nancy Paris. I'm the president of the Georgia Center for Oncology Research and Education. And I'm here to talk to you about a request on behalf of the Georgia Cancer Control Consortium, of which we are a member. This is an 88-member organization that develops a state cancer plan under the aegis of the Georgia Department of Public Health. And it's a 5-year plan with measurable goals and phenomenal progress. The thing that I want to make sure that you're aware of today is that cancer has become the leading cause of death in Georgia. It's one of the costliest diseases that we face, It's also one where there are the greatest opportunities for prevention, for control, and for treatment. And we've made huge progress on those fronts collectively in Georgia. I want to just make sure that you're aware that in addition to the Georgia Core Network, which includes almost 1,000 oncologists and catalogs and curates over 650 cancer clinical trials in the state, we've established networks among cancer centers from every corner of the state that enables timely, effective treatment to be available to citizens, 48,000 of whom are diagnosed, will be diagnosed this year. And I'm sure you're aware how much it touches your families and those of your constituents. So our job at Georgia Core is to link about 50 Commission on Cancer designated centers and university centers where there's funding from the National Cancer Institute and many other sources to develop these treatments. But the funding from the state of Georgia is critical to the linkages that we have established. I'd like to just highlight, and you've seen some of these materials before, but I've highlighted specific information about our request, that we've created a unified request with two top priorities at the health plan, the cancer plan for this year, that include funding for Georgia Core and funding for the regional cancer coalitions. The $1.15 million that is requested for Georgia Core would expand the depth and breadth of our research network, the data collection that we have, the online cancer information center that disseminates information about and increases access to clinical trials. In each of these instances, we have a plan that you were presented when we visited you earlier that details exactly what would be accomplished, but we're welcome to, we'd be glad to answer any questions you might have on that. I know that when I visited you, you've asked, what is the tobacco settlement money used for? Because traditionally, cancer services have been funded by the state's tobacco settlement. And we've developed a newer handout that you have in your packet that shows, since I've been in this work, yes, it began in 2001 for me, almost 19 years, the state has received $3 billion in tobacco settlement funds, and historically, about 16% of that each year has been appropriated through your wisdom and generosity to cancer services. This year, Georgia's going to receive a 10% increase in tobacco settlement funding according to the governor's budget. So it'll be about $150 million that you will have the challenge of appropriating among many different and important causes. But you'll see from our graph that tobacco settlement funding fluctuates because it's a complex formula based on sales and things that I probably have no knowledge of. But what we've seen over time is that funding for cancer has not increased with the increases in tobacco settlement funds. In fact, the cancer appropriation has deteriorated, and the governor's budget this year recommends 9% of tobacco settlement funding for cancer. We're tied then for the lowest percentage of fundings with 2014 was the other year. So this concerns us because of the progress that we're making and the impact that this disease takes on our families and our businesses. I have an in-depth analysis, Tara, for you to take a look at of what we understand is the comprehensive history of the tobacco settlement appropriation in Georgia, and it does give a breakdown of what we're asking for your consideration. That would be an increase of $1.775 million in addition to the governor's recommendation that would cover Georgia Core's programs and the regional cancer coalitions. And Marilyn Hill is also on the agenda. Is it all right if she addresses this now since it's related? Okay. And then perhaps, should we take questions then after she speaks, or? Yes, sir. Okay. Thank you. Marilyn?
Good afternoon. That's a nurse speaking too loud. I'm Marilyn Hill. I'm the CEO of the East Georgia Cancer Coalition, and I am represented today with my 5 colleagues from the other coalitions around the state. As Nancy said, cancer is the leading cause of death in the state. However, since the tobacco settlement funds and the cancer coalitions were instituted, we have decreased the death rate in the state of Georgia by 15%. And that says a lot. All the coalitions have also participated in the development of the state cancer plan, and we support that 100% every year. When we make out our work plans, we make them out to hit what we agreed to in the state cancer plan. In 2017, the 5 coalitions in the state of Georgia. Now, I don't know if you remember, but originally, we had 9 coalitions, and when the money didn't come down the way Russ told us it was going to come down at the time, then coalitions dropped out. So we only have 5 covering the whole state of Georgia, and we're at the end of our road to provide more services to those counties that are not covered without more funds, but we could do that. And I think the other thing that's important is that our coalitions, as I said earlier, provided 3,800 free screenings to citizens of the state of Georgia. You would be amazed at the number of people out in the rural counties that don't have access to prevention and to preventative tests. I think it's twofold. Number one, I don't think there's a lot of people doing it, you know, but they're certainly not telling them about it. And that's the key. They have to know where to go and what they're due for. 290 patient navigators throughout the state of Georgia help us with that. They navigate patients to services that are available and help them to find resources for things that they cannot do or they cannot provide. So it's extremely important. You know, Georgia has always been ahead in this one area of cancer. When we first looked at developing the statewide coalitions, Donna Shalala at Health and Human Services recognized Georgia for being a leader in doing this. So as we continue to push, I've been doing this now for 19 years, as long as Nancy, and my children think it's time I should retire. And I tell them, when I'm ready, I'll tell you what I'm going to do. So please send us some help. We do need this money so that we can help our citizens go on and get the care they need. Thank you.
Thank you. Don't have any questions for you. Thank you. Oh, all right.
Mrs. Hughley.
Go ahead.
Mr. Chairman, thank you. I just want to say that I'm very pleased that the cancer coalitions are united this year. You all do great work, and I have referred some constituents to my cancer coalition, and they've never failed me yet in terms of taking care of them. So we thank you for what you do, and we're thankful that everybody's on the same page this year.
Thank you. And your coalition leader would be here, except I believe she's at home with the flu.
Thank you. We have another question for you. Representative Gardner has a question. Thank you. Let's see, Jenny Helms, and after Jenny Helms, we'll have Daniel Thompson.
Mr. Chairman and members of the committee, I appreciate the opportunity to be here. I am the president of Leading Age Georgia, and we're an association that provides education and policy for the mission-based organizations that serve seniors through the continuum of care across Georgia. And so we have over 170 housing and service providers who serve over 126,000 residents and clients in Georgia. And several of the people who spoke about adult days are our members. And I just want to make a couple of brief comments because they did such a great job of representing the need for an increase in funding for Adult Day. But the main point that I want to make is that the people who are served through Adult Day are there because they can't stay at home alone. Their medical conditions are what allow them to meet the waiver requirements. And so they're lucky that they have family members who can take care of them if they can get this adult day service during the day. So our members estimate that about 90 to 95% of those they serve have Alzheimer's or another form of dementia. So the oversight that's provided, particularly the medical oversight, as well as the activities, really are what they need, but it also allows that adult child to keep working, to keep employment, so it's a win-win. And so with this 5% increase that we're asking about, we can keep these adult day centers viable. And the main issue that I think that they're facing is being able to pay for staffing, because it does require the nurses and the LPNs and the RNs, and the rate increases in the past haven't kept up with the cost. They're having a very hard time recruiting and keeping these staff, and those are the vital part of keeping an adult day so effective in caring for the people who needs these types of services. So we estimate it'll be a cost of about $400,000 of state dollars, and we greatly appreciate you entertaining this request.
Thank you. We don't have any questions. Thank you. Daniel Thompson, and next up after Daniel Thompson will be Emily Jones.
Good afternoon, Mr. Chairman, members of the committee. Thank you for letting me provide testimony on the FY 2019 state budget. My name is Daniel Thompson, and I am the Executive Director of the Georgia OBGYN Society. The OBGYN Society is the professional association for OBGYN physicians in Georgia. Organized in 1951, today the Society has over 950 members and operates the Maternal Mortality Review Committee in partnership with the Department of Public Health. I come before you today to bring testimony on two items that the Society is supporting: funding for the prevention of maternal death and OBGYN residency training. The practice of obstetrics and gynecology faces significant challenges in Georgia, chief among them the fact that nearly half of the counties in Georgia do not have an OBGYN. This fact, coupled with poor health status among women, can create a perfect storm for the quality of women's health and reproductive health outcomes in our state. These factors have been major reasons why Georgia has had the dubious distinction of being a state with the highest rate of maternal death in the nation. Since 2014, the Society's Maternal Mortality Review Coordinator has been studying maternal death records, and in consultation with the review committee established by the General Assembly, has determined that the most common causes of pregnancy-related death are hypertensive crises and maternal hemorrhage. These are consistent with the top causes of maternal death nationally. Accordingly, the American College of Obstetricians and Gynecologists, in partnership with nurses, midwives, hospitals, and state health departments, have developed maternal quality improvement bundles for hypertension and hemorrhage, known as the Alliance for the Innovation in Maternal Health, or AIM. The OBGYN Society is supporting a request from the Department of Public Health of $2 million in the FY 2019 state budget to implement these quality improvement initiatives in rural hospitals with labor and delivery units in our state. In partnership with the Georgia Hospital Association, this appropriation will create grants to hospitals and fund the staff necessary to oversee and measure implementation of these bundles. The second item that the Society is supporting is state funding for OBGYN residency training in Georgia. Currently, Georgia graduates approximately 25 OBGYN residents each year, and about half stay in the state for a fellowship or to begin practice. Since FY 2016, the General Assembly has funded OBGYN resident slots in Georgia, and this is a continuation of that funding. The request this year is for $459,900 and would fund 6 slots at each of the OBGYN resident locations in Georgia. These are not new slots, and they are not slots that are being moved from any other specialty. This appropriation would support existing positions. And this appropriation continues support for OBGYN residents that is currently being afforded to family physicians and pediatric residents, and there is a critical need for the OBGYN specialty in Georgia. Mr. Chairman, members of the committee, for far too long, Georgia has been at the bottom for women and maternal health outcomes. My father, an OBGYN, was a lead author of the first maternal and infant health care plan for the state of Georgia in the early 1960s. Georgia's performance was poor then, and it remains poor over half a century later. Support for evidence-based initiatives that improve the quality of women's health, implemented with partners who share missions, is a unique opportunity for Georgia that should be seized. Coupled with continuing to honor support for the future of the OBGYN workforce can yield powerful results. Georgia has an opportunity to reverse a disturbing trend and set a path to be the #1 state in the nation for women's and reproductive health. Thank you for your consideration, and I'll be happy to answer any questions.
Thank you. Any questions? No questions.
Thank
you very much. Emily Jones and Andy Lord would be next.
Good afternoon, Mr. Chairman and members of the committee. Thank you for listening to me today. My name is Emily Jones. I am the Director of Advocacy and Government Affairs for the March of Dimes in Georgia. The March of Dimes is the leading patient advocacy organization for the health of women and children in the nation. I'm not going to reiterate everything that Daniel just said about the importance of the maternal mortality funding and the importance of the OBGYN residencies, but I will say that from the perspective of the mom and the baby, this funding is extremely important to improving the health of women and children in our state. We do rank among the last in both maternal mortality and infant mortality, and we are going up in rates of preterm birth. I do also want to take a moment to talk to you all about group prenatal care, commonly known as centering pregnancy. We have 16 sites in Georgia currently providing this model of prenatal care, which is different than other models of prenatal care. It's done in a small group setting. It's a longer visit, fewer visits, and it's been shown to have drastic results in reducing preterm birth rates, among other major outcomes for women and children, including both patient and provider satisfaction. However, the sustainability of these programs is not guaranteed without more funding. We have 16 sites, but they are struggling to remain active after grant funding runs out. I urge you all to consider this model going forward. It's extremely important for the health of women and children in the state, and we really need to ensure that as we are opening more of these sites in the state, that we are looking to their future and not just how many we're opening. Thank you, and have a great day. Oh, questions? I'm sorry.
Thank you. Okay. Andy Lord and then Dr. Jay Felstein.
Good afternoon, Mr. Chairman, members of the committee. My name is Andy Lord. I represent the American Diabetes Association here in Georgia. I want to start by thanking you, Mr. Chairman, and the members of the committee for some support that you all have already rendered last year. You all may recall that this subcommittee and full committee supported an appropriation to establish for the first time ever in Georgia a diabetes coordinator. Prior to that, as you all are probably aware, Georgia did not appropriate state dollars to diabetes, and the only diabetes appropriations or funding that we had in the state were federal, and they added up to about $240,000. For the size of our state, obviously we're concerned that that is not the level of appropriations that can adequately address the prolific incidence of diabetes that we have in our state. On your handout, which is a front and back, you will note some of the statistics related to diabetes here in Georgia. I won't go over all of them. The one that stands out to me is that the diabetes hospitalizations from Medicaid and the state health benefit plan alone resulted in about $30 million. But the total impact of diabetes statewide in Georgia was $5.1 billion. $3.3 billion of that was attributed to direct medical costs. So I know you all already understand the size and impact of diabetes and that it's having on our population and budget. I also want to thank real quickly Chairman Jason Shaw, who last year agreed to be our House Diabetes Caucus chairman. So he is helping us to organize and educate his fellow state representatives on the importance of beginning to address this. So again, we thank you all for funding the diabetes coordinator last year. What we are asking for this year is to follow up on that and to give that new diabetes coordinator something tantamount to an operating budget. This budget was already developed. The American Diabetes Association, Novo, a number of private sector partners, and others came together 3 years ago and developed something called the Diabetes Action Plan for Georgia, and that is a specific term. It was compiled by these public and private partners to deliver evidence-based, proven strategies to reduce diabetes incidence. And this has happened in, I think, 47 of the 50 states that have officially developed a diabetes action plan. On the reverse side of your statistics page, you will see the specific request that we are seeking for this year. And again, this would be managed largely by the new diabetes coordinator, and that is to implement the diabetes prevention program in the 10 highest need areas in Georgia. I say with some humor, I feel certain that Columbus, Gainesville, Swainsboro, Savannah, and Cobb are probably contenders for that based on population, and Atlanta, population, based on population, demographics, et cetera. So specifically what this line item does is trains lifestyle diabetes coaches so that a DPP, a diabetes prevention program site, can be established. Once a site is established and is recognized by the CDC, it becomes eligible to bill Medicaid, private insurance, et cetera. So a theme that you will note throughout these appropriations asks are that they are designed to leverage additional money from additional sources so that we can limit state appropriations but still have a greater fiscal impact. And that is one way we propose to do that. Secondly, on the prevention side, provider education to encourage providers to follow up with the screening recommendations and refer to these aforementioned diabetes prevention programs. You will note that is a very small, that's only a $30,000 item. And what you could expect to see from that is education programs in conjunction with MAG, the Nurses Association, pharmacists. This is primarily lunch and learns. These are advertisements in trade publications. These are for providing CEU credits, et cetera. So that's what that is about. On the control side is the additional accreditation of 20 DPP sites annually, a staff position to promote those, and you see the line item there for that, and graduating about 50 health professionals as certified diabetes educators. So again, it is our goal to invest in ways that we can leverage additional public dollars and private dollars and get large bang for our buck, but also begin to develop an infrastructure throughout the state of Georgia, particularly in these high incidence areas, where we can have a significant, quantifiable, meaningful impact on the incidence, prevention, treatment, detection, et cetera.
Thank you. No questions, Sandy. Thank you. Dr. Feldstein, and then Mr. R. and Reverend Gregory Carl Davis will be next.
Mr. Chairman, members of the committee, thank you for your time. My name is Dr. Jay Feldstein. I'm the president and CEO of Philadelphia College of Osteopathic Medicine, one of the oldest osteopathic medical schools in the country. We've been around for over 100 years. And in 2005, we opened our campus in Georgia. Since that time, we've graduated over 1,000 osteopathic physicians. In addition, we have our pharmacy school, our physician's assistant program, and are hoping to start a physical therapy program this June. As of December of this year, we were approved by our accrediting body to open an additional 4-year campus in southern Georgia in Moultrie. The goal of this campus is to really address the needs of rural southern Georgia in terms of primary care. The main goal of developing pipeline programs, middle school, high school, local colleges, so we really can have homegrown physicians in the region, so that after their training through their graduate medical education programs, they stay. We know from research that 80% of physicians where they do their residency is where they eventually practice. And that is our goal, to meet the needs of southern rural Georgia. And we thank you for your ongoing support for our capitation program for our existing students. We look forward to increasing that. Currently, we have 299 residents of Georgia in our student body. We receive capitation for 60. And we're looking to increase it, obviously, as we open our Georgia campus in the south, projected to open in August of 19. So we thank you for your existing support and ongoing support, and really look for a private state partnership to address the healthcare needs of rural Georgia. So thank you for your time.
Thank you, Dr. Phelps. No question for you. Thank you.
Chairman Paris and the members of this committee, I am the Mr. Right Reverend Gregory Carl Davis, Bishop of Georgia, in statute of 1758 in exile. And I'm here and I appreciate you hearing me out on behalf of Georgia on this issue of the Controlled Substance Therapeutic Research Act. And I have a statement I wanted to read I work without compensation to bring forward a cannabinoid medical food that contains new molecules that are formed through processing hemp seed oil and cannabinoid extracts. This product is being actively investigated by agencies with the federal government for military applications. The voluntary work of this ministry is to validate this product through the Georgia Controlled Substance Therapeutic Research Act. This act provides for statewide patient response studies. The FDA has published on their website documents on a botanical drug development guideline for industry. This work is compliant with FDA and DEA. This botanical drug has an alternate source of supply from the NIDA located at the University of Mississippi. Our consultant prepared a report on the Georgia current law and the Controlled Substance Therapeutic Research Act, and the copies are distributed there in this. The intention is to utilize the Controlled Substance Therapeutic Research Act in a voluntary program for chart monitoring patient response. This unfunded state mandate requires that the Patient Qualification Review Board is compensated for the required meetings under this act. The Georgia Composite Medical Board has not placed a budget request for the members of the Patient Qualification Review Board. The Georgia Composite Medical Board is recruiting members for the Patient Qualification Review Board for this program. And that's on the second page. This is from the Georgia Composite Medical Board's website.